Most women who develop gestational diabetes have no idea it's happening already. There's no pain, no dramatic symptoms. There's literally nothing obvious that happens for you to see. This is exactly what makes it very dangerous, because by the time your body starts showing signs, your system is already undergoing metabolic stress and your baby is also being affected. So in this video, I'm going to walk you through 7 subtle signs that screams gestational diabetes. Welcome to Mira's Health Hub. Quickly tap on the subscribe icon and let's begin today's episode. Gestational diabetes mellitus is a condition where the body cannot properly regulate blood sugar during pregnancy, hence gestation. This is not because your diet is sugar or carbohydrate heavy. It's primarily due to placental hormones making your body resistant or unresponsive to insulin. So even if you're doing everything right, your blood glucose levels can still rise. That's why this condition can affect anyone regardless of lifestyle, as far as you're a pregnant woman. For this reason of unpredictability, we screen for it every antenatal visit, and sometimes the body also gives you subtle clues which we will be discussing. So grab your jotters and pens and let's note them down. The first sign to look out for is excessive thirst that feels different. In some women during pregnancy, they feel thirsty, but this kind of thirst I'm referring to is quite different from the regular pregnancy thirst. It's very persistent and uncomfortable. You drink water, within a short time, you need more water. This happens because when blood glucose levels rise, the body tries to dilute these sugars. So it pulls water from the cells into the bloodstream to aid the diluting process. This will trigger the brain's thirst center, making you drink more water. So it's not just I feel thirsty, it's more like your body actively trying to correct an internal imbalance. So look out for over thirstiness. Secondly is frequent urination beyond expected pregnancy changes. Now, pregnancy comes with frequent urination, no doubt, but where you should pay more attention is if you're urinating more frequently than expected and waking up multiple times at night and also passing very large volumes of urine outside the regular quantity you would pass on a norm. This is different from bladder pressure caused by the baby. In this case, your kidneys are working overtime to remove excess glucose from the blood. In the process, osmotic diuresis occurs, which is excessive water loss as a result of your body trying to remove the excess glucose. So the more the glucose in your system, the more fluids you will lose through urination. The third sign is fatigue that doesn't improve with rest. Fatigue in pregnancy is expected, but this type feels way deeper. You sleep, you rest, and yet you still feel drained. Why this happens in gestational diabetes is because even though there is plenty of glucose in your bloodstream, your cells can't effectively use it due to insulin resistance. So the body is essentially in a state of cellular energy deficiency. Think of it like having fuel in a car, but the engine can't access it properly. That disconnect leads to persistent fatigue. The fourth sign to look out for is recurrent infections you can't explain. This is one of the most overlooked signs. If you're experiencing repeated UTIs and vaginal yeast infections, it may not be just coincidence. Elevated blood sugar creates the enabling environment for bacteria and yeast to thrive because they feed on glucose. So the higher the glucose levels in the blood, the easier it is for infections to develop and recur. This is especially important in pregnancies because infections can complicate outcomes if not properly managed. Now, do you see why I say gestational diabetes symptoms hides under pregnancy signs? Everything I've been listing so far still falls within signs and symptoms of a pregnant woman, but it does well to hide under the symptoms. So that's why they are very subtle, and if you don't pay close attention, you might just miss them. To my fifth point, increased hunger despite eating well. You've eaten, but you still feel hungry shortly after. Now, I don't mean prego cravings. I'm talking about actual hunger, if you know what I mean. This happens because your body isn't effectively using the glucose you consume. So even though your blood sugar is high, there's glucose, your cells are starving because they can't access it. So your brain's response to this situation is to signal you to eat more. trying to meet up an energy demand that isn't properly fulfilled. Now to the sixth sign. We are getting there, guys. Stay with me. The sixth sign is presence of glucose in urine. This is something we don't miss. Okay, we test every pregnant woman that comes in for antenatal visits for presence of glucose and protein in her urine. During antenatal checks, attention is paid to your urine sample collected. Normally, the kidney reabsorbs glucose completely, but when blood glucose levels rise above certain thresholds, the kidneys cannot keep up and the glucose spills into the urine. Okay, so this urine test is often one of the earliest clinical clues that something isn't right. So go for your antenatal visits. Now to the final point, your baby measuring larger than expected. Sometimes the first sign doesn't come from you, it can come from your baby. I've personally seen this happen to someone. Excess glucose in the blood of the mother crosses into the placenta and enters the baby's circulation. Now, the baby's pancreas is responding to it by producing insulin. It's the baby's own insulin, which acts as a growth hormone. This would lead to increased fat deposition and accelerated growth. While a big baby might sound harmless and cute, it increases the risk of difficulty while delivering the baby, birth injuries, and cesarean section. Now, let me say something that is very important. Listen attentively. You can have gestational diabetes and experience none of these symptoms I've just mentioned. Yes, none. And that's why screening, typically between 24 and 28 weeks, is absolutely essential. If gestational diabetes is not managed properly, it can lead to excessive fetal growth, complications during delivery, and increased risk of developing type 2 diabetes mellitus later in life for both mother and child. But when detected early, it can be managed effectively through diet, monitoring, and sometimes medications. And many women go on to have completely healthy pregnancies and babies. So people, I hope I haven't scared anyone today. That's not my intention. It's not about fear, but about awareness. Your body is constantly communicating with you, even in the most subtle ways. And understanding these signs gives you power to act early, seek help, and protect both yourself and your baby. If you notice any of these signs, maybe 2 or 3 of them, don't panic. Just speak to your healthcare provider and get proper evaluation. I also tell mothers that come for antenatal visits that you need to ask questions. No matter how stupid you think that question might be, ask that question, because you might just be saving someone next to you that is dying in silence, having the same thoughts in their head, but does not have whom to ask. Come to me, ask me any question. I'm here to help. I'm here to provide the information to help you live your life better. So if this video helped you understand gestational diabetes a little bit better, share it with someone who's pregnant or planning to be, because sometimes the smallest piece of information can make the biggest difference. And if you want more clear, medically accurate explanations like this, or you just like my face, subscribe now. Please subscribe, share my content, and tap the bell icon so you are among the elite viewers to see my videos as they drop. Until next time, bye bye.